very much, Petrie. Thank you, ladies and gentlemen, for joining us in another Thursday afternoon, as expected, COVID Conversations. We have an interesting discussion lined up for you this evening, and we promise to, hopefully at the end of it all, help you to understand and appreciate more about COVID and the response of the government, and indeed the response of all of us. Today our spotlight is on our young people, the youths, and we have a subtitle, Protectors or Super Spreaders. Oftentimes we talk about vulnerable groups, which are normally aged persons, senior citizens with comorbidities. We rarely speak about young people and the role that they play, perhaps because we feel that they are more resilient to the COVID virus, and the evidence does support that. The truth is, they have a role to play, a very important role to play, and that role can be enhanced once we work together as all Jamaicans and understand and fully appreciate how they can be protectors as opposed to super spreaders of the virus. So that will be the central discussion that we will have today. We have, in addition to the introductions led by Petrie, we also will have Dr. Abigail Harrison, consultant pediatrician and adolescent medicine specialist, who will give us some insights on our youth as it relates to COVID-19, their vulnerabilities, and what role they can play to overcome those, plus help others to overcome the virus. And we hope to have later on two testimonials from two young persons, one person out of St. Elizabeth, Jordan Dresike, founder Balaclava Youth Club, and Janelle Small, President Mona Law School, Law Society, University of the West Indies. So we'll go right into it, and I'm going to ask now our epidemiologist, Dr. Webster Carr, to just give a quick update on the status of COVID, certainly over the past week or so.
Thank you, Minister. Good evening. So what we're going to do today is give an update on the situation. We have, as of yesterday, 8,067 confirmed cases, of which 488 were imported. For active cases in the last 2 weeks, we have 1,233. And the next slide will show you a breakdown by age group. And the number of active cases by age group in general is highest in persons aged 30 to 39 and least in the younger age group of under 10. And however, with respect to the fatality rate, as age increases, so does the fatality rate among persons. So we're talking about the youth today. So this demonstrates the number of cases in the different age group. The adolescent has 209 cases cumulatively, and the youth 18 to 24 have 983 cases. When we look on the number of cases over time, the peak seemed to have happened mid-August. However, it takes about 2 weeks for us to be sure exactly what is happening with respect to the spread of cases. When we look at the parishes, how the cases are throughout parish by time of concern, we have St. James, Kingston and St. Andrew, and to a lesser extent, St. Elizabeth, but St. Elizabeth seemed to be having increasing cases currently. When we look at the number of days it took to reach 1,000 cases, each 1,000 cases, it took us the longest, 151 days for the first 1,000, and since then it has been decreasing up to the 6th and 7th. However, we noticed that there seems to be an improvement or a slowing down on the number of cases. So it took us 10 days to reach from 7,000 to 8,000. The cases, when we look at the deaths related to the number of cases, we see that the number of cases peaked in week 36, but the deaths peaked in week 37. So there's a delay in deaths of about a week. When we look at male versus females, the death rate or the case fatality rate among males is greater than that of females. And by age group, as you get older, the case fatality rate increases as you get older. By parish, the case fatality rate is highest in St. Elizabeth, Westmoreland, Manchester, and Clarendon. So when we look at the deaths per population, similarly, Manchester, St. Elizabeth, St. Catherine, and KSA are of concern when we look at the number of cases per deaths per population. On average, persons stay in hospital between 0 to 46 days, an average of 10 days, and we had 6 persons who were dead on arrival to hospital. So the next slide gives you a picture of the number of COVID-19 cases per population, per community. So this is the cumulative picture. And so the darker areas will be more cases per population. And over the last 4 weeks, this represents the active cases per week. So the pinker areas, or the deeper the pink, the more cases. And so there are some areas that parishes that have an increase in number of communities involved, including St. Catherine and St. Elizabeth. It gives you the number of cases, and we will follow that slide with the proportion of active cases to all cases. So in the last 2 weeks, the greater the proportion of cases, the darker the spots. So those communities are the communities of interest. And this gives you the rates, number of cases per population. The next slide gives you the top 20 communities. First, we look at the communities' number of active cases per population. So we have Irwin, Bogue, then Raytown. But we also look at the number of cases that occurred in the last 2 weeks. And that plays a part too, because Raytown and Longsville Park have the same number of active cases per population. But it will be more concerning for Raytown that has 20 active cases versus 8 active cases. So we look at these numbers to see areas of focus. This looks at the death rate by community, so by population, and the darker areas are the communities with the highest death rate. And so this is where we will end the figures and numbers and what this means. Thank you.
Thank you very much, Dr. Webster Carr. But I wanted to ask you 2 quick questions, just for clarity and for context, on the issue of age and infection rates versus age and death rates. Let me confirm for me if I'm interpreting you correctly, which is that the virus is more among the younger population. So as you get older, there is less numbers in that population in terms of the virus, but the deaths are more in the older population. Am I interpreting the numbers correctly?
Yes, so then the death rate is higher in the older population, but when we look at per population, because there are less older persons than
Sure,
persons
sure.
in their 30s. But when we look at by population, persons in their 30s are the persons who have the highest number of cases and the highest rate of infection. So,
But not deaths,
but not deaths.
per capita, per population.
Exactly.
Right, so it's an important point, because what it says in the context of discussing the youth is that the young people are still very much vulnerable to getting the virus, although it is more the older persons who are dying from the virus.
Correct.
And the question is there a relationship between the two? Hence the theme, protectors or super spreaders, because the virus can move from the young to the old, from me to my mother, from me to my grandmother, and will do more damage to my mother and grandmother, even though, because it's so prevalent among that population, the risk there is quite high, which means we have to ensure that young people are protectors and
Right.
not super spreaders.
Yes.
The other question I wanted to ask, and we'll come into sharper focus on the issue later on, but the other question is the issue of the infection rate. You did say that your peak is in August and that there is a lag, which may be 2 weeks or so, but there is definitely an indication that the rate of spread is
It's
declining, is slowing.
Yeah.
Let me use that term.
Yes.
Okay, can you elaborate a little on that for us? Because that represents some hope, right?
Yeah, so what we are seeing is the increase can be very sharp, which what we saw around August 8, 7, 8, it does sharply increase. What seems to be happening is the slope or the rate of increase is slightly decreasing and slightly increasing, or maybe plateauing, leveling off. And I'm hesitant to say it may be going on,
We're not pushing you to say it because
there is hope.
some slowing.
There is some slowing.
How long since the inflection point are we? How many weeks since we classified community transmission? It's been what, 4 weeks? 5?
So the community transmission was September
3rd?
3rd.
3rd?
Yes.
Okay, so we're now in October, mid-October. Okay, so it's about
6 weeks.
6 weeks.
Yeah.
6 weeks. And we did say that the spike normally would go between 2 to 3 months. Didn't we say that?
Yes,
Okay,
correct.
so is it fair to say, and I know we have lots of margins of error, right? So I'm not trying to get anybody to be complacent. We have to remain vigilant, but is it fair to say that the virus is performing, at least from the data we have, in a way that is relatively consistent with the projections or predictions or forecasting?
Yes, that's the national picture, but we must also look at the more local picture, what's happening on the ground. So we may say overall for Jamaica, it's slowing, but there are some parishes where it's increasing. So we have to be
Very
mindful
careful.
of that.
Okay, no, that's important and for our listeners to understand. Plus, just to add additional caution to the conversation, we have seen jurisdictions or countries where the virus has slowed, and then for one reason or the other, you see a second wave. In fact, a second wave is becoming more a feature of the virus than an exception. Countries that thought they would have herd immunity, in Europe, Italy, the UK, other places that were perhaps a little more liberal in their approach to restrictions, are now seeing second waves, and therefore we really cannot take anything for granted. And I think that's the substantive message that you're trying to get across. So thank you very much for that. Now, ladies and gentlemen, the issue of young people, the youth, the population that is, let's say, 30 or 35 and under, is an important population in the COVID response. It's an important population in our country. These are some of the more productive years. These are some of the more active years. These may even be described as some of the more rebellious years. Rebellious meaning not necessarily being a deviant to all concern, but being more adventurous. Some people may even classify it as youthful exuberance, right? I'm sure you have heard that terminology before. But what that means is that young people are more active. They push the envelope a little more, and that's understandable. And even with the restrictions that have been imposed, many have not captured a sense of urgency or even a sense of fear as it relates to the COVID-19 virus, because the data suggest, and it's a narrative that we have pushed, that young people are more immune, if you will, less likely to face severe consequences from a clinical perspective, less likely to die, and that to some extent has bred some levels of complacency. What we want to do today is to demonstrate why complacency cannot find any favor or place in the COVID response, and to put it simply, largely because young persons may not die from having the virus, but they certainly have the capacity to spread the virus to the older population. And there's no separation between the young and the old in our society. We all go home to our grandparents and parents, or pass them on the street, or sit with them on the bus, or drive with them in the taxis, or go to church, or sit on the choir with them, or the bars, or wherever. And as a consequence, we commingle. Commingling is a part of our culture. And so we have to be careful. We all have to be careful and define a perspective that may not immediately speak to the dangers that we face as a young person in this instance, but the dangers that we could represent to others, older persons who are around us. So we're focusing on the young youth today, and the Ministry of Health and Wellness has defined a strategy that we've been working on to look at young people and their role, and we're going to be rolling that out and making that a more active part of the strategy, just as we have with the worker welfare program for the frontline workers, healthcare workers, and we have on mental health, which is a sort of universal side effect of the restrictions from the COVID virus. The 2020 COVID-19 Knowledge, Attitude and Practices Survey done by the Statistical Institute of Jamaica earlier this year revealed that there was some disparity in the perception of risks across not only sex and health regions, but also across age, which is what I elaborated on earlier. The data showed, in fact, that among all age groups, persons 18 to 24 years had the lowest perceived risk of contracting COVID-19. It follows, therefore, that this group of individuals would be less likely to be as vigilant as we need them to be in order to curtail the spread of the disease. The ministry's own data is also telling us that the recovery rate from COVID-19 decreases with increasing age, while death rates increase with increasing age, as was shown by the data from Dr. Webster Carr. In other words, our younger people are more likely than our older persons to survive COVID-19. So that's a clinical statistical fact based on the data we have now. And that is demonstrated globally also. Yet we are aware that it is our younger persons who are spending more time outside of their homes, whether for work or to socialize, with the result that when they return indoors, the risk to their older family members is greatly enhanced. And that's the potential to become a spreader of the virus, a carrier and a transmitter of the virus. And depending on how much you move and how many places you go, you could be classified as a super spreader of the virus. It is against this background that we this evening are engaging the COVID conversation, zoning in on our youth, and to say, ladies and gentlemen, that we want our young people not to be super spreaders, but to see themselves as protectors of the older population. In other words, they must define a role for themselves that seek to look after their loved ones. I said it in Portmore, Waterford yesterday when I met a group of young people having fun under a tree, celebrating the birthday of one of the group. And I said to them, listen guys, observe your distancing, wear your mask. Remember now, you don't want to carry this virus home to grandma because they are your loved ones. And nobody wants to see grandma die or get terribly ill, or father and mother. So for this reason, we have developed a program that we're announcing today, and we'll elaborate more on tomorrow at 1 o'clock. at the conference center, where we will have a number of young leaders, both in-house and online, a program that we call COVID-19 Youth Leaders Response Program. And this is similar to the other programs that we have developed that we feel is justified on the basis that we need to target focus around components of the COVID response that touches on subgroups, and to enhance the awareness among those subgroups or conditions in order to increase the chances of overcoming the virus. So the objective of this program is to promote positive behavior response and effective engagement from young people towards the protocols established by the ministry to protect the general population. And to do so, we are seeking to provide community-based support. So it's the youth leaders in the community who will then carry the narrative once they are bought into that narrative around protecting their loved ones, their older cohort, foster relationships between youth and health services through organized community engagement and intervention. A number of our community health aides are young people, and we want them to identify the 1,400 or so we're going to be engaging with other young people in the community as an active response to get those young persons to recognize that they have an important role to play to protect themselves and, by extension, protect those around them. And use of media communications to get that messaging out in a more targeted way to create the awareness and hopefully solicit the appropriate response. We're targeting young people between the ages of 14 to, I would say, 35, and from rural and urban Jamaica. And the idea is to recruit, to sensitize, and to deploy as change agents across their respective communities, starting with our youth leaders. And we have hundreds of young people who run the community-based organizations, the sports clubs, the 4-H clubs, clubites, and I could go on and on. At the church level, the youth leaders, we want them to be part of this COVID response because we believe they can communicate and they can understand and can become instruments of change based on their leadership qualities. We're going to be engaging our members of parliament and our political leaders to nominate their key youth leaders to get them involved also because they carry significant influence on the ground. Once identified, youth leaders will be sensitized on the protocols and invited to provide insight on the best ways in which infection prevention and control measures can be effectively sustained in particularly among those age cohort, but very importantly, how they can protect others around them by protecting themselves, and in particular vulnerable groups that they interact with. They will then be tasked to go into their communities to do the required work among both young and older persons, utilizing a range of strategies or tools to do so. There will be strict adherence to the protocols as established by the Ministry of Health and Wellness while we engage, and we will promote and preach and try to justify that. So the physical distancing, the mask wearing, the sanitization, and all the other elements of the protocol will be important to get buy-in to that approach among that age cohort. Tomorrow, we will officially launch the program at 1 p.m. at the Jamaica Conference Center, where we'll have at least 50 or so youth leaders from across the country, and that's at the location with appropriate distancing. And then on Zoom, we will have another set of young people who will speak to around the program that will promote guidance and guidelines and address the COVID-19 related needs of the most vulnerable in their communities, provide guidance on thorough hand washing practices to reduce spread of the virus, safely help seniors and other at-risk groups to access supplies such as food and medication, and to provide peer support and find ways to check on and support others around the similar mental health agenda that we have. That event tomorrow will see presentations, a COVID update, but also presentations from persons who have done research in the area to place in context the role of young people in our society as change agents, the impact of COVID on our youth population, but also what our youth population can do to advance the cause of the COVID response to overcome the particular challenge. The ultimate expected outcome is to appoint a number of young leaders, up to 700 or thereabouts across the country at the parish level, and to provide ongoing updates to them and appropriate recognition for them to become part of the overall COVID response. So, ladies and gentlemen, this is our first introduction of a targeted program for our youth, and the justification is quite obvious. We want our young people to become part of this army of the COVID response, not super spreaders or spreaders of the virus, because the virus is unlikely to impact them in any significant way. It will, in an indirect way, if not them, their loved ones, and that is something we know they do not want. So at this time, I am hoping to have online Dr. Abigail Harrison. Do we have her online? Dr. Abigail Harrison is not yet? No? Okay. Okay, so we're hoping to have consultant pediatrician and adolescent medicine specialist, Dr. Abigail Harrison. If she's not, you're working on that? Okay, so we'll get that. Do we have our youth leaders online? All right, so let's go into hearing from our youth leaders, and then we will move from there. We have Janelle Small, president of the Mona Law School, University of the West Indies. Hi, Janelle Small.
Hello, good evening.
How are you?
I am doing fine, sir, and you?
Not bad, thank you very much. Well, we are happy that you're able to join us, and yes, we're seeing your face now. Thanks for coming on. First of all, congrats on your leadership role, president of the Mona Law School, University of the West Indies. I know that's a big task, and we wish you all the best in your tenure as well as your studies. Janelle, you may have heard the conversation leading up to this point around the role of the young people. Give me your personal views, if you will, and
Yes.
others listening on would appreciate what your thoughts are around this COVID pandemic, and how you think young persons view it and how they are coping with it.
Yes. Well, of course, the COVID-19 pandemic has affected us all in various ways, especially young people through employment, education, mental health, and definitely just navigating the new normal of online learning and, of course, financing for education during all of this is a hard experience, and the youth are definitely affected. And it is important that, as you mentioned before, that young people should be the protectors and not the super spreaders. And I do believe, or my personal perspective is that we all have a role to play in this. We all have a role to play. That is, firstly, I believe that young people should, of course, wear the mask, exercise social distancing, sorry, and of course, ensure that we play our part in mitigating the spread or reducing the spread of the virus. So that's the first thing I believe that young people in this particular fighting the COVID-19 virus, we play a critical role in. I also believe that young people are the future, and we are learning and we are going to school, and it is also our job to educate others on this. Not everybody really understands the impact of this virus, and we don't want it to get to a point where it's too late. So it is important that having the information and ensuring that we're getting information from the correct sources is important, to ensure that we can pass it on to others. And I believe that's another critical role that young people should play in this fight. Also, it's a time where everybody is in need. And of course, we are in need as well, young people. But it's never a time where we cannot donate, even if it's our time, it's just energy and effort into helping others. And so it's important to give back to other students, give back to persons in our communities. If it is that you need to give away masks, just as how the Minister of Health has, it's important that we play our part as well. I know the Guild Council has been doing a lot so far in donating not just to university students, but other students as well, because everyone is facing a little trouble at this time. And it's important that we find ways to give back
So let me
as
ask
young
you,
people.
let me ask you, Janelle,
And definitely,
let me
yes,
ask
go
you,
ahead, sir.
let me ask you, Janelle, there is a sense though that young people are, that they don't take the virus as seriously. You know, they do their, you know, young people will always be young people. Let's face it. But nevertheless, this is a global pandemic, and you know the
True.
partying and the you know the river bashment and the you know socializing with others around. You know, it's. Do you get a sense that as young people there isn't a sense of urgency around this virus, and if so, what will it take to sort of jolt that cohort into recognizing that there are dangers and that they can play a role as part of the solution?
Yes. Okay, that's a very important point, Minister. And the fact is, young people, if it's not knocking at their door, they generally don't act with a sense of urgency, and that is definitely true. Um, but the point is, we have to educate, because only when persons know exactly the dangers that they are facing will they act. And so I find it very, very heartwarming to know that there is a youth response to this in Jamaica, where the youth will be participating and educating others. So I think that is definitely the first step to allow students, sorry, not students, but young people overall to realize the impact and the dangers of the COVID-19 pandemic. Because as was mentioned before, and the facts have proven it, even though young people are not necessarily facing death at this point, in terms of not all young people are dying, we are still vulnerable to the virus, and we can act as super spreaders and pass it on to other persons who are more vulnerable. So I believe when faced with the hard facts through education, and definitely through the initiative that will be starting very soon, that is one step that we can take to ensure that young people wake up and realize exactly what's going on.
Uh, Janelle, thank you very much. We appreciate your coming on, and we anticipate that you're going to be part of that leadership core that's going to take the message to your cohorts across the country. So we look forward to that, and I suspect I'll hear from you or see you tomorrow when we launch the event at the National Conference
Yes,
Center.
sir.
Thank you. We seem to be having some difficulties getting right. Jordan, founder of the Balaclava Youth Club. I'm not sure there's a connectivity issue. So we do have though Dr. Abigail Harrison, consultant pediatrician and adolescent medicine specialist, and we're very happy to have her on board online. Dr. Harrison, welcome. Your volume is a little low. Can you turn that up for me? Dr. Harrison, you would have gotten the initial discussions around youth, and this is your area of specialty. You're based at the University of the West Indies, and you do a lot of research on adolescent medicine and adolescent health. Your take on the perception or the posture of young people in this COVID era around COVID, and how you think that may help or not, and what we may need to do to advance an agenda that young people can feel integrated into this COVID response.
Sure. Well, I'm generally always the optimist, and I really see our young people here and globally as being forces of change. And I think if we embrace them as forces of change rather than being barriers to improvement, then that's always the right approach. So I think your team is on the right path for sure. What I would say is that I think COVID-19 has really rocked everybody very
repeat symptoms now. Persons who never had any symptoms before may have depressive symptoms, and they are not coping with this sense of not knowing what comes next and how to manage that not knowing. And I think if we all sort of work together to recognize that everybody is struggling with this very high level stress, then it's going to make a big difference. I think we have to find a balance for young people. So, you know, they may be able to hang out with appropriate social distancing and wearing their masks. I know many of them find the masks annoying. I mean, many of us don't like to do it, but it's vital to stop the spread. And I think if we want our lives to go back to any sense of normalcy, then we just have to do what we have to do. So what I encourage young people to do is stay in ventilated areas, well-ventilated areas. Instead of having 10 of you hang together, maybe just 4 of you hang together, and you can space out a little bit more. And then you can have that sort of sense of relaxation among each other. And I think it all boils down to a sense of respect, should I say, respect for self, respect for the person beside you. Because although, yes, the young person, as you said earlier, because I was actually listening to you, Minister, although, you know, they are less at risk for becoming significantly ill, they still can, and there is no way you can look at the person sitting beside you on the bus, even if they're 15 or 16, and necessarily know whether they have some other illness that puts them at risk. You know, you don't know if that person just had chemotherapy, they're just leaving the hospital and going home, if that person has sickle cell disease, if that person has HIV, we don't know. And so we have to respect each other person as them potentially being at high risk of becoming ill. And so take that extra step, you know, to protect yourself and each other.
You know, Dr. Harrison, as I listen to you, and clearly you're the expert, I really feel compelled to withdraw parts of my earlier statement, because the truth is, I postured the activities of the young as being more about complacency and a disregard for the potential threat that they may represent as super spreaders. But you have brought into sharp focus, and I stand corrected, in the fact that our young people are also victims of COVID-19, in that they are suffering too, because they have had to alter their lifestyle. They have had to experience loneliness, mental issues, anxiety, and the word you use, which I fully appreciate and endorse, is that word respect. That any program that we build around that has to promote the concept and the need for us to respect each other, and respect each other in the context of giving support so that we can benefit from each other. And I'd like you to elaborate a little more on that, because the idea of our young people being victims is one that I think we need to ensure that we provide a solution to, a narrative, to give them support while empowering them to provide support for others.
Absolutely. So, you know, I think oftentimes as adults, we sort of underplay, or we look over our young people as potential victims. And I think sometimes, you know, we tend to worry about ourselves and not recognize that they too are going through the same things. And because they're younger, they may have less experience with dealing with something so traumatic. And so rather than us seeing them as a bother, we really have to kind of hold them and support them as they themselves go through it, because many of them are missing a lot of stuff, you know. I mean, our track stars are wondering, are we going to have champs next year? Or footballers, are we going to have Pepsi? Are we going to have Coles? Are we going to have Manning Cup? How am I going to get my scholarship to go to do wherever I wanted to go overseas? And so a lot of them, you know, they can't come and complain about that necessarily to their parents or their guardians, because people will say, are you kidding? You need to just be happy that you're healthy. And that's not a particularly helpful stance to use with a young person. We have to embrace the fact that they too are struggling, and we have to empathize with them, and we have to work with them. And I think if we can get them to understand that we see where they're coming from and we understand that the challenges are there, then we can make a big difference. I think sometimes we forget that being home, online school, Google Classroom, it can drive you a little bit batty. I mean, I lecture, and let me tell you, at the end of a day when I have lectured online, I'm exhausted because it is far more exhausting to do school online than to do it face to face, simply because you have to work so much harder to be engaged and to maintain that engagement for the entire 40 minutes or hour and a half or 2 hours of that lecture. And what can happen to the young people is that they tune out as well, or those that are really trying hard, they get frustrated, they feel exhausted at the end of the day. And the parents are saying, or the teachers are saying, but you know, you don't have things hard. Why are you complaining? Why you look so mash up? You're at home relaxing in your own space, you know?
Right.
So I think we really have to look at it from their perspective, even look at the risks that they face when parents are stressed, they've lost their job, they don't manage their young people as well, they argue with them more, they shout at them more, they hit them more, and sometimes we have predators that are around who may be clothed, you know, wolf in sheep clothing, so it might be a family friend or somebody else that may sexually abuse our young people. And
Right.
they're not necessarily in a space where they know who to tell that has happened and where to go to get help. So we really have to have our ears open, have our eyes open, and work with them closely.
Well, tomorrow at the launch, you'll be a special guest speaker. We look forward to your completing this narrative, which I think is very important. But another will be a presentation from the UNICEF report, which speaks to the younger age cohort up to the end of high school and the impact of the COVID restrictions on them, not being in school, being at home. Some of the very issues you raise, you know, parents having added responsibility to take care of them at home, loss of job, arguing, that sort of thing, which really has had an impact. So there's no doubt that the COVID-19 Youth Leaders Response Program, while we're looking for youth leaders in the first instance, the program clearly will also have to provide support, even while it attempts to encourage and empower those young people to provide support within the community to others. So really appreciate your contribution, Dr. Harrison. And we will catch up again tomorrow. I think it will be carried live, right? Presentations tomorrow. So for those who are listening and would like to get the other presentations, please tune in online and we will provide, you can get the full substance of the presentation. Thank you.
You're most welcome.
I understand that we have Jordan now, founder of the Balaclava Youth Club. Is he online, Jordan? Oh, Jordan. Wow.
Morning, sir.
Very good to have you, sir. We thought we lost you there for a minute. You're in living color. How is St. Elizabeth?
Well, St. Elizabeth is coping, but we, as community leaders, are doing our best to see how best we can institute a greater level of discipline and cooperation amongst our peers and the elders.
So tell me about the Balaclava Police Youth Club first. Just give me a 30-second overview so you promote your brand and your members. And then after that, tell me about COVID and your perspective on COVID.
Excellent. Okay, the Balaclava Police Youth Club is an interactive community organization that are engaged in community and outreach activities in order to assist in nation building, community building, improving lives. And that's just basically what we are about. We aid in strengthening our community as a group of positive people to build a positive image, because we are indeed strong, and we just want to emphasize on our ability to express and develop our space in a creative and positive way.
How has your activities been impacted by COVID, and what's your view or your members' view on the COVID pandemic so far?
Well, we outlined earlier in the year, we outlined a range of community activities or initiatives that we wanted to engage in. From May, normally we would treat students or children for May and Child's Month. We normally go in the basic schools, the primary schools in and around Balaclava and treat them with ice cream cakes. That was not possible due to the onset of the coronavirus, but nevertheless, we reached out to different care packages and other community aids. My mother is a dressmaker, so what we did, we built masks and issued to persons within different households in order to spread the message that, COVID-19 is here. And as a former youth parliamentarian, I also engaged in a social media chain to spread the message that COVID-19 is here and we actually need to protect ourselves and the community that we reside in. So that's what the club has been doing, and we are so elated to be here on this platform to create and institute public education to our people and in our community.
Yeah, I'm so proud of you and what you have said. I've never met you before, but you echo a type of positivity that should give all of us hope that the future is safe as a country and as a people. So I really want to recognize you and salute you for what you have said. Tell me about the older population. How do you as a youth club relate to the older population, your mothers and grandmothers in the community, particularly in the context of COVID? You say you make masks, and big up to your mom, a dressmaker who helps to produce those masks for you to give to others. You need to talk to me after. I'm going to provide the material for you, and I think it's something we need to do across the country, because the washable masks are going to be more sustainable rather than disposable ones, but that's another issue. Tell me how you relate to the older population in the community as it relates to COVID.
Definitely. So as it relates to the older population as well, we have a list of senior citizens in the community that we assist or try to assist on a monthly basis as a community organization. So we don't drop our guards when it comes on to the senior citizens. They are mandatory in upholding the institution of the community. So every month, at least every month, we try to reach out to them. We have persons on our list who are visually impaired, persons who are not able to walk and go about freely. So we try to reach out to them. One of the things that I'd like to do more is build more masks, but the access to material and elastic is very limited due to the high demand. So if we get more material and elastic, we'd be able to build more masks in order to distribute them and to further engage and educate senior citizens of the significance of staying home.
Well, I tell you, I am publicly right here and now committing to giving you more material and elastic from wherever we can find it. And it's something that I think we need to seek collaboration on through businesses. It's the fourth plank of the collaboration that we would like to speak to, which is how do we get the private sector involved as part of the overall collaboration to get all of society approach. So I think that's good.
Just to add, I'd like to add that though youth are being labeled now as being the main carrier transmitter of the virus, we ought to be careful of the stigma that may be attached to youth. And we don't want it to be in a way that it becomes disrespectful, because remember, we are trying to eliminate the disculture. So we don't want to shove them aside or say, don't come around because I want to transport virus.
Right.
We don't want to create that environment. So I want us to use the media carefully in addressing how we label the youths as COVID transmitters. So because we don't want to be associate any stigma to youth.
Well, I must tell you, Jordan, I am going to be the first to say if that was contained in the message that I transmitted, or anybody else for that matter, we withdraw that position, because that's certainly not intended. And you're right, perhaps we need to adjust the narrative, as
Yes,
was
sir,
said
please,
earlier by
because I
Dr.
heard it on
Harrison,
the news.
to,
I
to,
heard it
to,
on the
to,
news last night.
oh, you heard it on the news last night, to show
Yes.
that while it is true, it is statistically a fact that you have more fatalities among the older age cohort and more prevalence of the virus among the younger age cohort, what we need to do is to provide support and encouragement and motivation so that we all can work together. So I'm gonna close here, but I really want to thank you for coming on. I think you have offered some significant insights. I think your attitude and approach is worthy of commendation and recognition. And, you know, I only hope that you are one of a few hundred, but you are still one of a kind to bring the message of young people forward in a way that's going to promote what we want to promote here, which is a collaborative effort towards responding to the COVID virus. Thank you very much, Jordan, and we will be in touch. I hope you'll be online tomorrow, if not present at the official launch, and that you'll continue to play a role as a youth leader, maturing into an adult leader as a youth parliamentarian. So one day we may see you in Parliament, right? Thanks a lot.
Yes, sir. Thank you very much, and thanks for having me. And I just want to encourage Jamaicans and the diaspora to continue to remain COVID-free as best as possible. We cannot see or smell or taste the virus, so you ought to protect yourself, protect your individual space, your family, and immediate surrounding. Be safe.
Absolutely, absolutely. We'll talk to you off here, but thanks again. Ladies and gentlemen, I think we have had a really good set of conversations here, and that's what the COVID conversations are about. It's about exposing different angles to the discussion, all in aid of generating understanding and soliciting support and participation as we work together to overcome COVID. We're gonna, before we go into our questions, we want to do a short glance, an explanation at remdesivir, which is the drug, I hope I pronounced it correctly, Dr. Nadine Williams, that has dominated discussions over the past week or so. The ministry had put out a release recently, well, at least two, to say that we are going to be importing supplies for use under certain circumstances. I know there have been some misunderstandings around the drug, and so we've asked Dr. Nadine Williams to just quickly give us an overview on the drug and where we are. You may want to just turn on the mic, please.
Good evening, everyone. Thanks, Minister, for given us this opportunity to speak on this drug, remdesivir. Next slide. And so remdesivir is actually an antiviral drug. Which means that it is useful for preventing the virus multiplying. It is an injectable drug, and it is manufactured by Gilead as an innovative manufacturer. It is important to note, however, that clinical trials in the management of COVID are still being carried out in various countries, and so the drug has not received full approval in any country. It is, however, being used under emergency use authorization in some countries. And so in Jamaica, while we wait on full approval by registration, the drug can be used under the controls of a study, so a clinical trial, or under an emergency license. Next. So what are the pros and cons of this drug? And this is really only being discussed in the context of the evidence that we do have. And I must say it is important to realize that especially in this situation with respect to COVID, the evidence is evolving. So there is nothing that is concrete, the evidence is evolving. So we would have heard several reports being put out during the course of the year since the onset of the pandemic. and it is absolutely not concrete. Several media reports, not concrete, but for the evidence that we have, this drug has been shown in one of the reports, one of the trials that have been done, to have some evidence on the recovery time. It was said that it reduces the recovery time or time to recovery by 5 days, that there is some effect on the mortality rate, and that it reduces by 4%. And if used early enough in the clinical course, in the course of the disease, that it may actually reduce the progression, the likelihood of progression, or the rate of progression, or the extent of progression from the moderately ill to the critically ill. Now, the fact of the matter is that it does not show significant evidence. In fact, there is no evidence to show that in the critically ill, it is going to affect either recovery time or the mortality. So, in other words, the rate at which people would die from the disease. There are some who will say that it's an expensive drug, and as a study drug, that the side effect profile is incomplete. In other words, there are still bits of information that we want to know about this drug. Next. And so the side effect profile is wide as far as is known, as from as simple as a similar nausea and vomiting, a bit of stomach aches, some effect on the kidneys, the liver, affecting your blood, preventing your blood from clotting, etc. So there's a wide spectrum, and yet the side effect profile is still being analyzed. Next, please. There are some aspects of the drug which we usually test, like drug-to-drug interaction, which still isn't complete. And so we would have some caution in the use with other drugs. Next. And so Jamaica decided to procure a small amount of drugs because there was the evidence that was published to say that there is some benefit in the use of remdesivir. In addition, that we were seeing the local increase, the surges, and there were requests by attending physicians to say we would like to have a drug that might have an impact in some of our patients. But certainly, one of the reasons that is being put out for the intent to procure the drug is that the time to acquire the drug, which has to be signed off on, it has to be imported. It may take some days, important days, with respect to delaying the importation of the drug. So in order to have a pool of drugs, if it is that the physician asked for the drug, that it would be there, that it would be ready, and in addition to that we have this pool of drugs before rolling out of either trial or if there was definitive treatment. So in other words, before there's a distinct drug that has been put out to say, okay, this is the drug that has maximum effect on COVID-19 patients, we would want to have something that has shown some benefit in our armamentarium, in our little toolbox to say, yes, we can treat or we can actually help in a context. Next. And so the indications for use, well, if it is that the patient is proven to have COVID-19, if the patient is moderately ill and in hospital, if they can actually get an IV drug, or for patients under the care of somebody a clinician, a licensed clinician who is skilled and is able to monitor the patient. Next. And so I would say that with respect to administration of in terms of the use of the drug, the patient must be hospitalized and diagnosed with COVID, as I've mentioned. Informed consent must be obtained. That is absolutely important. And so a doctor has to explain what is it that they're wanting to achieve, what are some of the side effects of the drug, and the patient has to give their consent. The drug has to be monitored, just like controlled drugs, just like controlled substances. We have to know exactly where each vial of drug is. The drug has to be administered to patients who are in fact closely monitored. So therefore, it is important to note that this is not being rolled out for general use or just sort of, well, not general use because it's not an approved or generally registered drug, but it is a drug in which the FDA has given emergency use authorization, and it is on that basis that, well, that is one of the reasons why this drug has been said, yes, we've gotten for emergency use authorization. And in addition, there must be the reporting of the outcome of the use of the drug. So that is really it in a summary with respect to remdesivir. Would you like to speak to the process to accessing the drug? So, go on.
Okay, that's it. Thank you very much, Dr. Nadine Williams. Anyone wants to add anything? No? So, ladies and gentlemen, there you have it. We have given an overview on this drug that has been somewhat controversial, has been discussed. The ministry has to take a more conservative stance, particularly when it deals with drugs that are still, in a sense, in a trial phase. And even though there is emergency approval, I know there has been a big call for the drug to be more accessible, more available. But we have to approach it with some amount of caution. Nevertheless, the decision has been taken. Drugs have been ordered. I understand if the batch will get here next week, I'm told, right, Dr. Lewis Graham, and will be available through this public system, but has to be accompanied by certain protocols, approval or accepting to take the drug, and of course recording information around any effects that the drug may have. All right, so we're going to now go into our questions segment. I'm going to ask Petre to now take the mic and let us hear from our media or listening audience who may want to comment.
Okay, thank you so much, Minister Tufton. At this stage, as Minister has indicated, we are inviting questions from our media stakeholders. And I see here an initial question from Ms. Emma Lewis, who we know is a freelancer and independent blogger. Emma, please go ahead.
Hi. Thank you, Petrie, and thanks for introducing me. Good evening, everyone. I have, just a couple of questions, and one is related to the youth. I mean, it was great to hear from Jordan. I don't want to exaggerate the impression that they're spreaders and so on, but I'm not getting a handle on who are symptomatic. Do we know whether it is that young people are asymptomatic? Is that the reason why they may be regarded as super spreaders because they don't know they have it and they're going home? I don't know if that's possible to gauge. The other question I had was really about testing, and I'm still not quite understanding. We have at least two communities that are under special, monitoring at the moment, I think, but where our testing numbers still seem to be fairly low, this week at least. Now sorry, one more question regarding remdesivir. Will that be available? You said it would be, it's coming in next week, and it might be available in the public hospitals. But what will it be in terms of cost? Do you think that would be covered by insurance and so on?
Okay, the answer to the last question is that there's no cost. I mean, we have a no user fee policy. So the fact that we are procuring the drug will be available free of cost, free of charge, but again, subjected to the protocols of someone accepting to take the drug. and of course
Right.
the follow-up information. On the other two questions,
Okay.
the issue about young people and knowing their status, particularly if they're asymptomatic, I'd want one of the clinicians. Okay, Dr. Spence, you want to take that, and you may want to give an update on the testing also.
Okay, thank you, and good evening, everyone. So in terms of the young persons, so some of the young people, or most of them, usually are asymptomatic. And so the connotation might be there that yes, they can be super spreaders. But one of the things we want to ensure that persons are aware of at this time when we have community transmission, we have to treat each other as if every one of us potentially has the virus. And therefore, each and every one of us has a responsibility to ensure that we continue to practice the infection prevention and control measures that we should be able to wake you up in the middle of the night in your sleep and you can repeat it, which means wearing your mask, having that social distance, physical distancing, as well as washing your hands regularly or sanitizing. And so once it is that we are all as individuals practicing that, whether or not you're young or old, asymptomatic or symptomatic, it means therefore we are all protecting each other from actually contracting the virus. In terms of testing, in terms of the communities that are currently under quarantine, for Whitfield Town, in terms of the information we have, we would have taken approximately 116 samples, 17 of which would have come back positive. And one of the challenges we are having is that persons don't want to be tested. And so we really want to encourage the community members, whether, to come out once it is that the team is in the area. What we are trying to do is to ascertain how widespread the infection is within that particular community, so we know what type of interventions and strategies we need to implement, therefore, in order to protect further spread, or prevent, I should say, further spread. For Waterford, we would have done 177 samples thus far. Again, the community members, some of them are a little bit hesitant to be tested, and so we want to again encourage persons to come out and get tested, because this facility is available to you out there. And from that batch of testing, we have had 19 positive cases thus far.
I just want to add, in terms of the general testing, we anticipate that will change in terms of more access and availability of options to test. Today I had a meeting, a follow-on meeting with the private labs. I think maybe 8 of them were present in that meeting, along with with Dr. Spence and others, and the National Public Health Lab reps, where I think we're making good progress in terms of the final approvals, if you will, for these labs, or at least some of them, to engage in PCR testing. And we're looking between now and the end of this month to try and finalize that. They've come to some agreement in terms of the cross-matching of tests. That was sort of a sticking point, where the National Public Health Lab, or should I say the Public Health Lab system, wanted a sort of validation exercise done with the other 2 labs that are offering. They have not refused, so they are available and willing. And it was just about how you agree on the parameters of that kind of engagement. I've had 2 meetings, the last one today, and I think we have now come to some agreement. We're hoping that once that is done, then their legitimacy, from our perspective anyway, would now allow for greater options through the public-private arrangement. Beyond that, the other labs are engaged in a training process by PAHO, as well as our public health labs, for the antigen testing, and that is going on, and we're anticipating that that process will be concluded soon. So when we engage antigen tests here in Jamaica, it will not just be offered by the public sector, but also by the private sector. This will significantly transform the landscape for testing and allow testing on demand, corporate entities to have their protocols that includes testing, as well as, the public system having less burden on them to do all the testing that is required. So we look forward to that, and the government and the ministry is pursuing that aggressively. Next question.
Okay, our members of the media are reminded to utilize the raised hand feature in order to submit your questions. That being said, the next question comes to us from Cassius Watson from Jamaica Social. Cassius?
Hi, good evening, folks. I have 4 questions, one of which I think the minister partially answered. But the first question is to the CMO, the assistant or acting CMO, and as well as the chief epidemiologist. What is the age profile of those who are not hospitalized? I believe there are 180 something persons. Judging from your last numbers, what are the age profiles? What percentage is above 65? That's one question. The next question was going to be to the minister, asking when will antigen testing, if it had begun, but you just obviously said that it is not yet a go. But you did suggest in previous press conferences that you would have gotten that material over 80,000, I believe you said 80,000 kits, and you would have started the process in October. Today is the 15th of October. What's the status and when does that begin? I think that's very critical for Jamaicans to know that, or given a very solid word on that. Third question is to the epidemiologist. Is it are the numbers? How do yeah, regarding the numbers, what sense do you have that you normally this target is used, it's called the R, which is the rate of infection. What is it right now? I know that in previous press conferences, the Prime Minister would always on his board tell us what that figure was initially. I notice I'm not hearing it being mentioned anymore. What is the current rate of infection for Jamaica? What is our R rate? You have said in previous press conferences at least a couple months ago that a good space is below 1%, below 1, not 1%, below 1. Where are we right now? What's our rate of infection? And the fourth question is to the minister. I spoke with 2 people yesterday, and one person today actually in Crossroads, and he's saying, "Do not do the test. They might try to kill you off." Those are his exact words. So obviously you have what you have suggested and others have suggested, that people are resistant in resisting testing. What do you plan to do to get around that challenge, Minister? Because people literally are not willing to do COVID-19 tests, and then if we're going to be doing testing and contact tracing, clearly it's going to play an integral role.
Thank you, Cassius. You have asked so many questions, about 4 or 5. So let me try and get the responses now. I'm not even sure where to start. Who wants to take the first one, which is the issues around age cohort and testing? Dr. Williams, you have that? Positivity, right.
I may just, Minister, to take that one. Unfortunately, we don't have the age breakdown of the patients at this moment who are hospitalized. We just, in terms of up to yesterday's number, we have a total of 302 persons who are hospitalized. 194 would have been confirmed as COVID-19, and we have 108 suspected. But we certainly can provide to Mr. Watson at a later point the age breakdown in terms of the profile of those patients.
Okay, and then the issue of antigen testing is that the orders have been placed with the PAHO WHO group, We have to wait on them. While we're doing that, the training has commenced. We had the first training session last week. I think there's another one scheduled for this week, which includes also some inspections and a protocol basically for those who are going to administer the test. So there is an anticipation that by the end of the month we'll have a clear date. If not already begun, we would have been very clear, much clearer in terms of when we will start. But these processes have to take place, and some of the variables are not totally in our control, given that we have to depend on PAHO to mobilize or make their final arrangements for the movement. But we have those on order, and the training has commenced. Then there was a question for you.
Okay, yes, thank you. With respect to the estimated reproductive rate, we look at about 2 weeks from today, and we are over 1 at about between 1.1 to 1.4, thereabouts, is the current reproductive rate. So we are still above 1, but we seem to be slowing, as you would have seen from the numbers that we gave. So we went up as high as 2.7 in early August. So there seems to be slowing, but we will always be increasing if the reproductive rate is above 1. What we needed is for it to be below 1. So there's still work to be done.
Okay, Petre?
I am seeing no additional raised hands. And so, Minister, that brings us to the end of the question and answer segment for today. And I hand over back to you, sir.
Okay, so ladies and gentlemen, we want to thank you for participating in our COVID conversations this evening. We had a very interesting evening in that we had discussions around the youth and youth engagement in the conversation. I think we had some interesting interviews. Tomorrow at 1 o'clock, we will launch the youth program as part of the COVID response. I think what came out of today is clearly the need for young people to be engaged, both to assist them to overcome their own challenges, but also, very importantly, to help them to help others in overcoming those challenges. And the two youth leaders demonstrated, I think, the willingness to engage. Our expert, Dr. Harrison, also spoke to some of the issues that we need to address. And the Ministry of Health and Wellness, of course, looks forward to providing that. Before we go, I want to ask for a minute to divert somewhat from the norm, and I want to recognize, and this is a personal recognition now, Antoinette Christina Aiken, this lady who is consistently with us, every COVID conversation, consistently with the Jamaican people, whenever policymakers speak and otherwise, because guess what? She has been duly and appropriately recognized for her contribution to the disabled community, and in particular, the deaf community, as a significant communicator of all the messaging that we as policymakers would like all of Jamaica to understand, including the deaf community. And she has been duly awarded Order of Distinction Officer Class. And Antoinette, Tony, I know you were sad that your grandfather wasn't there to celebrate with you. Well, I'm sure he's watching you now. And we want to say to him how proud we are of you. And we present to you right now a little token of our appreciation and recognition. And we're giving you permission not to give any signaling now. Just take the award. Very well. You are a landmark in the context of Jamaica, and all that you have done for the disabled community and the deaf community. I think I say on their behalf how much we appreciate you, and from the perspective of us here as a ministry and as policymakers, and Jamaicans, we want to say the same. We appreciate you. Thank you very much. And God bless you, and continue to work hard and continue to shine and to pursue your dreams and goals. Love always. Ladies and gentlemen, on that note, thank you very much. This has been another COVID Conversations.
COVID-19 is still here. Always wear your mask correctly while in public places, covering your nose and mouth at all times. Masks should never be worn over the head, under your chin, below your nose, or hanging from your ears. Recovery from COVID-19 can take up to 60 days or more. The mask or the ventilator? You choose. A message from the Ministry of Health and Wellness.